This video is brought to you by Saraswati Vidyalaya Union. And hi, this is Prapti. Let's study about the nutritional disorders and disorders of digestive system. In this, the first concept that we have to know, that is nutrition. Nutrition is what? It is a supply of materials, food required by organism and cells to stay alive. That means it is the nutrition. And what is the nutritional disorders? So these nutritional disorders, it is a disease that result from excessive or inadequate intake of food and nutrients which lead to the condition. Now this nutrition related disorders, it can be categorized based on the food that an individual consumes and condition that develop due to malfunctioning of the organs or glands that are associated with the digestive system. The common nutritional deficiency in India, so if you observe, that is the related to the protein energy, that is a malnutrition, anemia, iodine deficiency disorder, vitamin A deficiency disorder, as well as vitamin D deficiency. But in this, we are going to study in detail about only two things. Okay, so such as you are already aware that little extra or less of nutrition can lead to the dietary disorder. Inadequate intake of proteins causes protein energy malnutrition, that is known as the PEM, and it can be associated with the inadequacy of vitamins and minerals in diet. Now here PEM, that is a protein energy malnutrition, it can cause diseases like kwashiorkor and marasmus. So this kwashiorkor and marasmus we are going to study in detail. Now see this diagram, see this picture. With the help of picture you will understand what is the exactly kwashiorkor. But this kwashiorkor disorder, it is due to the protein deficiency. So that's why it is also known as a protein deficiency disorder, and it is generally found in children between 1 to 3 years of age. Now here the children suffering from kwashiorkor, these are underweight and show stunted growth, poor brain development, loss of appetite, anemia, protruding belly, slender legs, bulging eyes, edema of lower legs and face, change in the skin and hair color. So all these are the symptoms of kwashiorkor disorder. Now with the help of picture, so you can easily identify the kwashiorkor disorder. Now here actually this protein energy malnutrition, this contributes to 60% of total 10 million death of children of less than 5 years. In these two forms which just now we have seen, that is kwashiorkor and marasmus. But one more is there, that is anemia. Anemia is also one of the nutritional disorder. But in our book only two given, that is kwashiorkor and marasmus. So just now we have seen about the kwashiorkor. Now the next one is there, so that is known as the marasmus. In this marasmus, it is prolonged protein energy malnutrition, that is known as the PEM. It is found in infants under 1 year of age. In this disease, protein deficiency is coupled with lower total food caloric value. In this, inadequate diet impairs physical growth and retards mental development. Here you can see these are the symptoms of this marasmus, such as physical growth and it retards mental development, subcutaneous fat disappears, ribs become prominent, limbs become thin, skin becomes dry and thin and wrinkled, loss of weight, digestion and absorption of food stops due to atrophy of digestive glands. There is no edema. See this picture. With the help of picture you will understand all the symptoms of this marasmus. Actually, this marasmus, it is one of the form of malnutrition, and it happens when the intake of nutrients and energy is too low. Okay, it leads to wasting or loss of body fat and muscles, and this child whichever having this marasmus may not grow as a children usually do. Okay, so this major cause of these disorders. Now let's study about this. Here, first one, that is unavailability of nutritious food, poverty, large family size, ill spacing children, early termination of breastfeeding, maybe the reasons are variable, and over diluted milk are the few important causes. Because malnutrition, that is the infectious disease, become opportunistic and it wasn't in this condition. But remember this one, proper diet. Okay, proper diet can help in the reversal of these symptoms. Now here in this marasmus, a person is extremely thin, and this shows the signs of wasting in areas of the body. Now the next nutritional disorder, that is indigestion. Now let's study in detail about this indigestion. But remember this one, this indigestion, that means upper abdominal discomfort, which is described as burning sensation, bloating of the gasiness, or nausea, or feeling full too quickly after starting to eat. That is known as the indigestion. But see this, in this indigestion, overeating, inadequate enzyme secretion, spicy food, and CXT can cause discomfort, and various symptoms are there. Means it is called as the indigestion. Improperly digested food or food poisoning also can cause indigestion. And here it leads to loss of appetite. Acidity means acid reflux, means from the stomach that acid comes towards the esophagus, and through the esophagus then it comes into the mouth. Okay, so this acidity, that acid refluxes, heartburn, regurgitation, dyspepsia. Dyspepsia means what? That is upper abdominal pain and stomach pain. So all these are the symptoms of this indigestion. So how to cure this indigestion? In this, avoiding eating large meal, lying down after meal, avoid spicy, oily, junk food, avoid smoking and alcohol. These are the main and the important preventive measures for this indigestion. So remember this one, this indigestion can have causes that aren't due to underlying disease. Actually, this indigestion, the examples includes eating too much, drinking too much, food intolerance, or taking pills on an empty stomach. All these are also the common causes of the indigestion. Okay, now the next thing, that is known as the constipation. In this constipation, when the frequency of defecation is reduced to less than once per week, the condition it is called as the constipation. In this constipation, if you observe here, difficulty in defecation may result in the abdominal pain, distortion, rarely perforation. Okay, all these are the things included into the constipation. Now the causes are what? The causes are affected colonic mobility. Actually, it shows effect on the colon. Colon is what? That is the part of stomach, means the part of intestine. Okay, so it causes are affected colonic mobility due to the neurological dysfunctions like spinal cord injury, low fiber diet, inadequate fluid intake, and inactivity. So here, how to cure this constipation? That is rough face, sufficient fluid in diet, exercise can help improve the condition. But remember this one, in the constipation, when a person passes less than 3 bowel movements a week or has difficult bowel movements, that is known as the constipation. And the common causes are what? In this constipation can have causes that aren't due to the underlying disease. Example include dehydration, lack of dietary fiber, physical inactivity, or medication side effect. All these are the reasons of constipation. Now, now the next one, that is diarrhea. Diarrhea means what? That passing loose watery stools more than 3 times a day. It is called as the diarrhea. Means what? This loose watery stools that occur more frequently than usual. In this diarrhea can lead to the dehydration. Means the more water losses takes place through this diarrhea. The other symptoms are what? That other symptoms are blood in stool, nausea, bloating, fever depending on cause and severity of the disorder. And the causes of diarrhea are infection through food and water, or disorders like ulcer, colitis, inflammation of intestine, or irritable bowel syndrome. All these are the causes of diarrhea. In this diarrhea, it is usually caused by a virus or sometimes by the contaminated food. Less frequently, it can be seen that sign of another disorders such as inflammatory bowel disease or irritable bowel syndrome. Now, what are the common causes here? Such as diarrhea can have causes that aren't due to the underlying disease. Example include a liquid diet, food intolerance, stress, anxiety, and or use of laxatives. These are also included into the diarrhea. Now, the next one, that is known as the jaundice. In this jaundice, or you can say that is hepatitis. Now, in this jaundice, we all associate jaundice with yellowness of conjunctiva, of eyes and skin, and white stool. Now, these are the symptoms of condition called jaundice. In this jaundice, it is a sign of abnormal bilirubin metabolism and excretion. The jaundice develops if excessive breakdown of red blood cells take place along with increased bilirubin level than the liver can handle, or there is obstruction in the flow of bile from liver to duodenum. So that time this eyes color, the skin color becomes yellow. This bilirubin, which is produced by the liver, that produced from breakdown of hemoglobin, is either water soluble or fat soluble. This fat soluble bilirubin is toxic to brain cells. Hence, serum bilirubin values have great diagnostic importance. There is no specific treatment to jaundice. Supportive care, proper rest are the main treatments given to the patient. In short, you can say that the yellow skin, which is caused by buildup of bilirubin in the blood, and these jaundice may occur if the liver can't efficiently process red blood cells as they break down. It's normal in healthy newborns and usually clears on its own. At the other ages, it may signal infection or liver diseases, that is jaundice. These examples, the common causes are also there, but remember this one, medication side effect, it is also one of the common cause. Okay, so this is about the jaundice. But remember this one, this jaundice must always be evaluated by a doctor. Okay, whenever that person is not feeling well, so see a doctor immediately. Okay, notice any yellow tint to the skin or eyes of an infant, child, or the adult, you have to consult doctor. If you have seen any dark color urine or abdominal swelling or expansion, so you have to take medical help. Okay, you have to take prescription from the doctor. So this is about the jaundice. Now the next one, that is known as the vomiting. In this vomiting, it is the signal means in this condition the stomach contents are thrown out of mouth due to the reverse peristaltic movement of gastric wall. Generally what happens, that food material from the mouth it enters into the esophagus, from the esophagus it enters into the stomach, and from the stomach it enters into the intestine. So this movement is taking place due to the peristaltic movement, means due to the particular muscle, means there is the presence of circular and longitudinal muscles. Due to the contraction and relaxation of that muscle, that food material is passing easily. But here what happened, in this vomiting there is a reverse peristaltic movement takes place. So instead of moving that food material into the next part, so it moving in the reverse direction. Okay, generally here it is controlled by the non-vital vomiting centers of medulla, and this vomiting it is typically associated with the nauseatic feelings. Okay, so this is about the vomiting, but remember this one, this vomiting it is due to the hangover also, in pregnancy also, or overeating or motion sickness also. It depends on that proper situation. In this vomiting, forcefully expelling the stomach's content out of the mouth. That is the concept of this vomiting. You can take the self treatment also for this. For example, taking small sips of oral rehydration solution, for example ORS, it may help prevent dehydration. If fluids stay down, eating toast, crackers, gelatin or other easy to digest foods may ace and upset stomach. Or if suppose there is a heavy chest pain or blurry vision or confusion, high fever or stiff neck, so then you have to consult doctor. Okay, so this is about the vomiting. Thanks for watching this video. Please like, share and subscribe my video. My channel name is Prapti Vanzari. Thank you.